Welcome to Healing Horizons. I'm Chris Daniels, and today we're navigating how to prepare for your first Ibogaine session in Mexico. Preparation isn't busy work. It's the backbone of safety, clarity, and long-term outcomes. Ibogaine is a catalyst, not a standalone cure. Your groundwork, medical, psychological, logistical, determines how well the medicine can work and how you'll sustain change afterward. We'll cover intentions, screening, clinic selection, travel, what to expect, and integration so you can step in grounded. Start with intentions. Ask, what am I seeking? Freedom from opioids, relief from trauma loops, a life reset. Write it down daily for a week. Clarify outcomes you can influence. Honesty, effort, aftercare, engagement. Release magical thinking like one and done. Instead, frame Ibogaine as opening a door you'll keep walking through with therapy, community, and routines. Bring a statement to your session, plus a few questions. Expectations aligned with reality lessen fear and amplify learning. Medical screening is non-negotiable. Provide a full history, including substances, doses, timelines, and complications. You'll need an ECG, electrolytes, liver function tests, CBC, pregnancy test when relevant, and cardiac evaluation if indicated. Contraindications include significant heart disease, prolonged QTC, serious liver impairment, pregnancy, and unmanaged psychosis or mania. Disclose fainting, seizures, eating disorders, and sleep apnea. These aren't barriers to care. They inform plans. A responsible clinic will consult cardiology or psychiatry when needed promptly. Do not self-taper. Involve your prescribing clinician and the clinic's medical team to plan evidence-based washouts. Certain medications increase cardiac risk or blunt Ibogaine's effects. Examples include methadone, buprenorphine, SSRIs, antipsychotics, and stimulants. Yet changes must be gradual and supervised. Be precise about substances, including benzodiazepines, alcohol, kratom, and supplements. Ask for a timeline and bridge supports. Comfort meds, sleep plans, craving strategies, and monitoring. Honest disclosure saves lives and reduces withdrawal instability before travel and dosing. Choosing a clinic in Mexico. Look for licensed physicians on site, continuous cardiac monitoring, crash cart, defibrillator, and clear emergency transfer protocols. Review staff bios and ratio per patient. Integration support should be built in. Red flags. Guaranteed cures. No ECG or labs. Vague addresses. Pressure sales. Dismissing risks or secrecy about medical oversight. Demand informed consent. Benefits. Risks. Alternatives. Research limitations. Privacy practices. Fees. Documentation. You always retain the right to pause or decline. Psychological preparation steadies the journey. Begin weekly therapy, practice mindfulness or breathwork 10 minutes daily, and assemble grounding tools. Body scan, paced breathing, a comforting phrase. Anticipate difficult material. Rehearse how you'll ask staff for help. Build a support system. Choose a trusted travel companion or a dedicated check-in person. Define boundaries and schedule updates. Clarify relapse prevention strategies and safe contacts. If PTSD is active, coordinate with your therapist for timing, stabilization, and integration cadence. Plan travel like surgery. Confirm passport validity, flights with buffers, ground transport arranged by the clinic, and a comfortable place to recover. Bring paperwork, medication lists, and insurance information. Pack loose clothing, eye mask, socks, lip balm, and hydration supplies if permitted. Discuss nutrition guidelines and fasting. Agree on simple safety signals with staff, thumbs up, thumbs down, or a word, since ataxia and nausea can limit speech. Schedule time off work and avoid major decisions afterward. During dosing, expect several phases: onset with body load and nausea, visionary or cognitive processing, and a wakeful afterglow. Ataxia is common. You'll be assisted when moving. Continuous monitoring tracks vitals and heart rhythm. Communicate needs simply water, blanket, reassurance, or ask for quiet. If music is allowed, choose gentle, non-narrative tracks. Approach the medicine with humility. Honor Iboga's traditional roots and the communities that steward it. Gratitude, consent, and respect set the tone for healing together. Plan aftercare before you fly. Book therapy or coaching. Line up peer support meetings. Consider recovery housing if needed, and schedule medical follow-ups. Build routines, consistent sleep, hydration, nutrient-dense meals, light movement, sunlight, and low-risk environments. Educate family on compassionate support and boundaries that discourage enabling while welcoming accountability. A client once said, "My preparation made integration feel like a continuation." That's the goal. Predictable scaffolding that catches insights and converts them into sustainable behaviors. As we close, remember, preparation empowers safety and meaning. Choose qualified clinics, disclose fully, plan washouts, and ready your mind, logistics, and support. Financial transparency matters. Request itemized costs, what's included, aftercare options, and refund policies. Takeaways: a checklist, intentions, screening, medications plan, travel, comfort items, supports, integration calendar, and a clinic questions guide, medical oversight, monitoring, emergencies, consent, integration. If in crisis, contact emergency services or 988 in U.S. educational, not medical advice. I'm Chris Daniels. Thanks for listening.